I am Professor Dr. Selvamani, HOD, Department of Anaesthesiology. Today I am going to talk about the history of anesthesiology. The modern anesthetic era is only just over 160 years old. Successful anesthesia for surgery was first demonstrated in 1846. Before that, the few operations that were possible were carried out either with no pain relief or after a dose of opium or alcohol. There were many attempts to relieve pain throughout the centuries. Early examples include loss of consciousness produced by blows to the patient's head or by compression of the carotid arteries in the neck. In the Middle Ages, elaborate potions included alcohol and various plant extracts such as mandrake root. Opium was widely used, particularly in China, and the first intravenous injection of opium was made in the 1660s. Pain relief in an arm or a leg was produced by squeezing the nerves in the upper part of the limb and also by applying the cold water, ice or snow. Hypnotism became popular as a means of pain relief and medical treatment during the late 18th and early 19th centuries. The 17th and 18th centuries were marked by a rapid increase in the knowledge of how the heart and lung work, as well as the properties of many gases. Joseph Priestley, who believed in phlogiston theory and photosynthesis. Later, oxygen was known as the gas with goodness. He isolated and identified alkaline air, ammonia, sulfur dioxide, and oxygen. He separated oxygen from nitrous oxide and nitric oxide. In 1799, Sir Humphrey Davy suggested the use of nitrous oxide to produce pain relief. 25 years later, Dr. Henry Hickman described the use of carbon dioxide to produce loss of consciousness, while Horace first used nitrous oxide for extraction of the teeth in 1844. Horace's demonstration of nitrous oxide was not successful. He suffered from severe depression and committed suicide by slitting the femoral vessels. Henry Hickman, he was MSc England, showed interest in gas theory, performed painless surgeries in animals by controlled asphyxiation with carbon dioxide. Ether Day, that is 16th October 1846. Although Paracelsus described the effects of ether on animals in 1540, the first use of the drug was general anesthesia was in 1842 by Drs. Long and Clark. On 16th October 1846, Dr. W.T.G. Martin gave the public demonstration of ether anesthesia in Boston. The operating room where this occurred, known as the ether dome, is preserved intact at Massachusetts General Hospital. The ether anesthesia was administered to Gilbert Abbott for the excision of the jaw tumor. The excision was done by John Collins Warrens. As the only means of communication was by ship, it took months for the news to reach the many countries, and the first recorded anesthetic Australia was given in June 1847. This picture depicts the first successful demonstration of ether. Gentlemen, this is no humbug, was proclaimed by Sir John Colin Warren. A few weeks after the famous ether demonstration, Oliver Wendell Holmes popularized the word anesthesia. He used the word to describe insensibility, more particularly to objects of touch as produced by ether. The word has been used previously to describe simply any lack of feeling, for example, that due to nerve problem. Holmes introduced such a combination of words such as anesthetic state and anesthetic agent. Professor James Young Simpson of Edinburgh introduced chloroform in 1847. He also described the first anesthetic death in 1848. The patient being a young girl named Hannah Greener. She was the first of many who suffered sudden cardiac failure under chloroform. In London, John Snow led the way in analyzing the complications after anesthesia and surgery. With a careful evaluation of postoperative deaths, he attempted to modify his practice by referring to what he had learned from the previous cases. August Carl Guster. He asked his assistant to administer deliberate spinal anesthesia on his own thicker with 2 ml of 1% cocaine solution, and thus spinal anesthesia was born. He also developed a smart bandage. He pioneered the IV procaine analgesia using a smart bandage. In 1885, in New York, Dr. Carning gave the first spinal anesthetic and then the first epidural anesthetic in 1901. Dr. Kalgoler first produced anesthesia of the skin and mucous membrane in 1884. Arthur Goodell's phases of anesthesia, Goodell's airway, Goodell's laryngoscopy, straight blade. Ralph Waters discovered Waters canister, endobronchial anesthesia for thoracic surgery, introduction of cyclopropane and carbon dioxide absorption method. Robert McIntosh found innovative methods of airway management, McIntosh laryngoscopy blade. In 1930, the general anesthesia became more pleasant for patients when pentothal or sodium thiopentone came into the use. In 1942, the muscle relaxation using curare was first demonstrated in humans in Montreal in 1942, allowing a lighter depth of anesthesia than previously were possible. In 1950, the investigations of hallucinated hydrocarbons as non-inflammable, highly potent anesthetic agents resulted in the introduction of halothane and the disappearance of ether and chloroform from most operating rooms. Cabinet respirator, negative pressure, non-noise ventilator. It is a power-driven tank ventilator. The patient is placed in the rigid tank from which only the head protrudes. Airtight fit is made by the flexible collar. It's carefully padded to prevent the viscose. Tracheostomy is best avoided. The tank is connected to a large mechanically operated bellows. During inspiration, bellows expand, air is drawn into the patient's lung until the elastic resistance of the lungs and chest wall equals the pressure difference between inside and outside the tank. During expiration, the bellows contract, the pressure in the tank rises to the atmospheric and air flows out of the lungs passively due to the elastic recoil. This is for long-term management of patients with a severe weakness of respiratory muscles with the pharyngeal and laryngeal reflexes intact like polio. This is a picture of ion lung. The modern era of anesthesia began in 1960s. With the development of new drugs, and the availability of new monitoring techniques and equipments. As more information became available to the anesthetists, so as to what was happening to the patients and in the anesthesia delivering system. So anesthesiologists begin to look more closely at safety and refinement techniques. Surgery was extended to increasingly complex procedures on patients which might previously have denied operations on the basis of age or illness. Anesthesia also led the way in analysis of critical incidents or the study of close calls, a process now being extended to other areas of medical care. The end of the 20th century saw major advances in everyday anesthesia, including contributions of computer technology, microelectronics, and advances in the drugs. Anesthesia is now tailored to each and individual patient, no matter if you are 10 weeks premature or 100 years old. Whether you are sick or well, there was never have been a safer time to undergo anesthesia. Those who don't learn from history are doomed to repeat it. Thank you.